perinatal substance use disorder care is a standard of care. It's an evidence-based practice care that everyone should be doing, that everyone should be able to assess, right? Diagnose, assess, and treat, just like you would any other chronic condition. When we look at why Project CARA uses the medical model or the disease model as primary, I think it's important to what that means, not only in our staff, but how we share that information with patients. What we know is that there are brain changes that when someone uses a substance, their response to it is different than someone who is not predisposed or has any risk factors for this disease. And it's why when someone is in active addiction, that someone from the outside can say, why are they acting like that? Like, it doesn't make any sense what they're doing. It's like they're not thinking. And again, that's a really great analogy because, well, they might not be able to be actually thinking the way we think of using our executive functioning, that they're actually in a survival mode, that their brain is telling them that to get through the day, they must have this substance. And when your brain is being driven from the survival mode, right? Eating, drinking, air, right? That overtakes all other priorities.
Perinatal substance use disorder, to me, I almost, as a pharmacist, take out the perinatal at times and just look at it as any other substance use disorder. For me, the perinatal portion comes in when thinking about what medications are appropriate for mom and for baby, especially in our opioid use disorder realm. We have buprenorphine, we have methadone, and we have Suboxone. And so all three medications have been proven to be safe, to be efficacious.
Through the course of someone's pregnancy, once they get stabilized on one of those medications, you know, their life really starts to change and can really see them start to feel better, both mentally, physically, all kinds of ways.
A common misconception about perinatal addiction is that a woman doesn't love her baby. She would just quit if she loved her baby. I have yet to meet a woman ever experiencing addiction who also didn't have some desire to do well for her baby and to provide something better for her baby. So it's a huge misconception.
They love the baby that they're pregnant with, and they love their families, and they love their children that they have at home. You give them a space to be healthy, and you allow them the ability to be healthy.
So giving moms the language and the framework to say, you know what, I respect myself enough to advocate for myself, because for so many of our folks, they've never had the experience of knowing that they have that power to request a different provider or to request to be treated in a different way, even if they are still actively using substances. Like, even if they are still using illicit substances, that does not negate their right to receive quality care.
Entering into a partnership with providers at Project CARA is really open and honest from the get-go.
If you can sit with me and be honest with me, you know I'm not going to try to shame or blame you so that you will change your behaviors. I think you physically leave space in the room for you to be able to put your guard down, for you to be able to relax in your own situation and have more space to determine what you want to do. And then the really cool part is that the team is then waiting right here, that if you need us, we're here. And if you don't need us, that's okay. Come back for another visit, we'll check on the pregnancy, and we'll go from there.
It's important to know that Project CARA is a harm reduction model above all. So it's really important for our patients to know that we don't expect them to have a perfect, crystal clear road to recovery, because we know that's just not how recovery works for the vast majority of people.
One of the reasons that I'm so open and out loud about my recovery is because there are so many different pathways and so many different ways to recover. And so any ways that I can champion the message for other people that recovery doesn't have to be this one box. Maybe your box doesn't look like somebody else's box. That doesn't mean it's not valid. It's fine, because that's your recovery.
And being treated with respect and dignity isn't just something for right now, but for your lifetime.
I'm grateful that the landscape of recovery and the landscape of pregnancy looks different than it did 2 decades ago. I'm grateful that it's different than it was a decade ago. And I'm hopeful for what it's going to look like a decade from now, to see where we go from here.